hemorrhage is very scary. We're joined by Dr. Max Gomez now to explain more about this particular condition.
So what exactly is a brain hemorrhage, first and foremost?
Well, a brain hemorrhage, by definition, is there's a bleeding blood vessel in the brain, and that really is a stroke. It's a kind of stroke. And the most common kinds of stroke are what we call ischemic. That's a blood clot in there. But we also have hemorrhagic strokes. About 15% of strokes are caused by a bleeding blood vessel.
And then risk factors and symptoms, when you go through that, it's stuff that we're all familiar with.
That's right. It's pretty much the same as heart disease and other kinds of stroke as well. We're talking about high blood pressure, an aneurysm that could start bleeding. That's also would be considered a brain hemorrhage, obviously, and a brain tumor can also cause that.
Let's talk about how to fix it. What would surgery for a stroke entail?
Yeah, the surgery for a stroke entails going in, finding the bleeding blood vessel and stopping it. So that's really the key. And sometimes those vessels can be very difficult to get at.
We don't know exactly the commissioner's particular condition, right?
No,
but
no.
in general, a prognosis, when you suffer something like this, where do you go from here?
It all depends on where the blood vessel, where the bleed took place, how big a vessel it was that started bleeding, where in the brain, and what kinds of damage it might have caused, how quickly they got to him. Now, obviously, he got to the hospital very quickly. The key there are the signs, right? The signs for a brain hemorrhage or a blood hemorrhage, brain blood vessel hemorrhage like this, is really the same as it is for any other stroke. It's fast is what we call it. It's a facial droop, loss of speech, loss of vision, partial paralysis, those kinds of things. It's the same as any other kind of stroke.
Right. And when it comes to prevention, right, exercise, maintaining the heart
thing, right? If it's good for your heart, it's good for your brain.
Yeah.
Good rule of thumb. Thanks, Dr. Max.
Thank you, Doc.